Fundamentals of Epidemiology. Definition of epidemiology. There are many definitions of epidemiology. The most widely accepted is the one given by John M. Last. The students are expected to remember this definition. And the key to remembering the definition is to understand the meaning and the importance of the crucial terms used in the definition. The definition of epidemiology is: epidemiology is the study of the distribution and determinants of health-related states or events in specified populations and the application of this study to the control of health problems. The crucial terms have been highlighted and now will be explained one by one. Study of the distribution of disease. Distribution means how is the disease distributed in the given population? Which types of people have more of the disease? Which types have lesser? Which geographical areas are affected more and which ones are affected less? Has the disease amount increased or decreased over time in the given population? This is known as describing the disease in terms of time, place, and person, and is called as the distribution of the disease in the population. Next is determinants of the disease. Determinants are also known as the risk factors of the disease. These determine the distribution of the disease. For example, poliomyelitis. Polio has been seen to occur more in under 5 age group, among poorer populations, among the illiterate, lower immunization coverage areas, those living in unhygienic conditions, lack of safe drinking water, etc. It has reduced in populations over time. Hence, the determinants here are illiteracy, poverty, low immunization coverage, lack of safe drinking water, etc. These per se are not the cause of the disease, not the cause of polio, which actually is a virus. Still, they increase the risk of getting poliomyelitis. Hence, poverty, illiteracy, etc. are the risk factors or the determinants of polio. Health-related states. Instead of using the term disease, health-related states has been used. This is because we don't just measure disease. We also need to measure other events related to health. For example, if you want to know the average blood pressure of a group, the blood pressure is not a disease, but it is related to health and is often required to be studied and compared. Another example is the average birth weight in a given country. Birth weight is not a disease, but a health-related event. Specified populations. When a disease or a health-related event is measured in a given population, the results are valid only for that particular population. It may or may not be extrapolated to other populations. Application of this study to the control of health problems. Once we have studied the distribution of the disease, the determinants of the disease, sometimes even the cause of the disease, we don't just leave it at that. Then what's the purpose of the whole exercise? Unless we apply this knowledge for treating the disease and preventing the disease by removing the determinants, the whole endeavor goes waste. So it is this application of the gathered knowledge which should ultimately lead to control of the disease and betterment of humankind. There are many more definitions of epidemiology, but they all agree at one point that the following three components are to be determined in epidemiology. These are disease frequency, disease distribution, and disease determinants. We shall explain these in the subsequent slides. Remember that though we have used the word disease, the actual meaning is health related states or events. Now we shall discuss each of these components in a little more detail. What is disease frequency? The frequency or the amount of disease is measured and summarized in forms of tables and graphs. The frequency of disease is expressed as a rate or ratio. We shall discuss more about these terms, that is rates and ratios, in our lecture on measurements of morbidity. Once you know the frequency of the disease or occurrence rate of the disease into different populations, only then you can compare the amount of disease in between these populations. By knowing the rates of disease in different populations or in different subgroups of the same population, you can get a clue to the etiology of the disease. Etiology means cause. By knowing what features are different in groups with a higher rate of the disease, you can have a list of determinants, some of which may later turn out to be the cause. Knowing how are the affected people different from the unaffected people, we can get a clue to the cause of the disease. For example, acquired immunodeficiency syndrome or AIDS. Initially, the cause was not known, but it was seen to be occurring with higher frequency among the commercial sex workers, their clients, and among IV drug users, etc. This distribution suggested that the etiology was probably infectious in nature. Finally, HIV was identified. Now, once we know some of the determinants of the disease, even if we do not know the cause, we can decrease the frequency by removing or modifying these determinants. For example, in the previously discussed case of poliomyelitis, if the levels of hygiene are improved, safe water is provided, immunization coverage improved, the levels of disease will come down. Disease frequency is also essential for planning the health services. Health services mean various clinics, hospitals, hospital beds, medicines to be supplied to these centers, etc. for controlling diseases. Each area is unique in having its own pattern of disease. For example, in India, infectious diseases like tuberculosis, vaccine preventable diseases of childhood are of concern, whereas in USA or Europe, the non-communicable diseases like cardiovascular disease, coronary heart disease, cancers may be more bothersome. Hence, we need to prioritize the diseases for which we plan the health services. No country in the world can have full facility for all the diseases that afflict mankind. So one has to know which diseases are more prevalent in the population for which the health services are to be planned. In addition to the disease, health-related events may need to be measured. For example, health needs, health demands, healthcare utilization, etc. We may be required to measure which health facility is being more utilized by the population. For example, in a village, a higher proportion of population may be visiting the private practitioners rather than the government health centers. We may need to investigate this further for the reasons. Hence, it is not only the disease but the health-related events which are measured in epidemiology. Also, health-related variables like blood pressure, serum cholesterol, height, weight may be required to be measured, and even these are not diseases, these are health-related states. Distribution of disease. We have already discussed that by distribution we mean the pattern of disease in the given population. By knowing the pattern of disease, we can help in generation of hypothesis. What is hypothesis? Hypothesis means the probable cause or the probable mechanism of development of the disease. As we have discussed, the dissimilarities between the highly affected and the less affected groups or areas may prompt generations of such hypotheses. Of course, these hypotheses need further testing. By identifying the determinants, we can identify the appropriate control measures. So the distribution of the disease is defining the disease in terms of time, place, and person. This is known as descriptive epidemiology. Determinants of disease. We have seen that the determinants may be identified, and one of these may turn out to be the cause. We identify the underlying causes or risk factors. This is the real essence of epidemiology. That is, to know the cause or risk factors of the disease so that we can control the disease. We have a full lecture discussing analytical epidemiology. The knowledge of determinants helps in development of scientifically sound interventions and health programs. What is health program? Health programs, by health programs we mean a group of control measures initiated by the administration, mostly the government of the area, to combat or control the most troubling disease of that area. For example, we have a TB control program in our country. Recently, one cause of lung cancer has been identified as smoking, and a few risk factors of cardiovascular diseases have been identified as sedentary lifestyle, diabetes mellitus, etc. through these epidemiological studies. Aims of epidemiology. We can summarize our previous discussion in the aims of epidemiology. These are: describe the magnitude and distribution of health and disease in human populations, to identify the etiological factors or the risk factors, to provide data for planning the health services, implementation of the health services, and evaluation of the health services for prevention, control, and treatment of diseases. At this stage, we will describe evaluation simply as repeated epidemiological studies in which the disease is described in terms of time, place, and person, and this will tell us if the disease amount has decreased over time and in the affected populations. If this has happened, that means the control program is evaluated to be effective. The ultimate aim of epidemiology, of course, is to reduce or eliminate health problem and its consequences, to promote the health and well-being of the society as a whole. Thank you.